Nobody is ready for the diagnosis of cancer, and breast cancer is no exception. With modern medical treatment, the outcome of breast cancer is very good, and most patients get cured. However, this does not mean that women with breast cancer are not worried. So initial days, you might think about, why me? You might think, what will happen to my larger life? What will happen to my children? And these thoughts are natural to happen to anybody who has to go through treatment with cancer. These symptoms of anxiety might be, short-lived, and after the initial few discussions with your oncologist, you might feel a bit more sure about what lies ahead. The initial few days of stress are often transient because after you get to know about the treatment process and you have discussed with your oncologist, you feel reassured that there is some ray of hope at the end of the tunnel. When you are stressed, we encourage you to do things that you like doing, spend time with your friends, and not make breast cancer your only identity. We as psychologists and psychiatrists are involved in supporting patients with breast cancer and their family members if these worries continue and persist. However, for a proportion of patients, they might feel low, feel tired all the time. They might feel like crying, and their sleep might be affected. So these are symptoms, when they come together, we call syndromal depression. Depression requires treatment, and this can be treated by psychological methods, by speaking to psychologists, through talking treatments, or you might require medications. Good news is that depression is completely curable, and with treatment, you should be able to get back to your usual life. One day, your treatment for breast cancer will end, and you need to be gentle on yourself while getting back to your usual life. Most patients regain their earlier lifestyle and get back to all the roles that they used to perform before the diagnosis of cancer.